Welcome to today's Explainer, where we're tackling a question that is honestly incredibly frightening, deeply confusing, and surprisingly common. Why do I get panic attacks for no reason? If you've ever been, just sitting on your couch watching TV or maybe walking down the street, and out of absolutely nowhere, your heart starts hammering, you can't breathe, and you feel this overwhelming sense of impending doom, then you know exactly how terrifying this is. You are completely blindsided. Today, we're going to unpack exactly why this happens using some real clinical insights, and more importantly, we're going to equip you with the tools to take your control back.
Seriously, have you ever had a panic attack for absolutely no reason? Think about that for a second. It is a profoundly isolating experience. Your body is suddenly hijacked, thrown into this massive fight or flight response, but there's no tiger chasing you, right? There's literally no immediate physical danger. It feels like your own body has completely betrayed you, sounding this blaring alarm for a fire that simply doesn't exist. It can make you feel totally helpless. But as we'll see today, you are definitely not alone, and there's a very real, very medical explanation for what you're going through.
So let's get into Section 1, the diagnosis, expected versus unexpected.
What's actually kind of fascinating here is that the medical community has a very specific classification for exactly what you're feeling. According to the DSM-5, that's the big diagnostic manual for mental health, panic attacks are actually grouped into two distinct categories. The first is expected. These are attacks linked to a specific known trigger. Think about things like a fear of flying, being packed into a dense crowd, or the pressure right before a massive exam. But then there's the second category, the unexpected panic attack. So the absolute crucial point for you to know is this. If you feel like you're having a panic attack for zero reason, with no trigger whatsoever, you're actually experiencing a clinically recognized event. You aren't imagining it. Your experience is real, it's documented, and it's completely understood by medical professionals.
Moving right along to Section 2, panic versus anxiety attacks.
Before we look at exactly why these happen, we really need to clear up a super common misconception, because distinguishing between these two is vital for understanding your own mind. People use the terms interchangeably all the time, but clinically, they're very different. Let's look at how they compare. A panic attack is defined by its sheer intensity and severity. It starts abruptly, literally out of nowhere, and the peak symptoms usually finish up quickly, wrapping up in about 10 minutes or so. It's like a short, violent storm. Anxiety, on the other hand, isn't a sudden explosion. It's a slow burn. The intensity builds over time, and it can persist for months on end. So, when we're talking about unexpected panic today, we are specifically talking about that abrupt, severe, 10-minute burst of terror, not the lingering, daily hum of general anxiety.
Which brings us to Section 3, the mechanism, a false alarm.
Okay, so what is actually causing that sudden 10-minute storm? Let's explore the root cause. Now, it's true that underlying factors like your genetics, pre-existing mental health conditions, or periods of massive stress definitely play a huge role in setting the stage. However, the immediate trigger for an unexpected panic attack is actually a biological misunderstanding. Panic is often triggered by misinterpreting the physical symptoms of anxiety. Essentially, your brain is playing tricks on your body. It acts like a faulty alarm system, taking a completely normal physical sensation and catastrophizing it into a life-threatening event, often without you even realizing you're doing it.
Here is exactly how that faulty alarm system goes off. You experience a totally normal physical symptom of underlying stress, like heart palpitations. But instead of recognizing it as stress, your brain screams, "I'm having a heart attack." Or you feel a quick moment of breathlessness or faintness. Your brain interprets this as, "I am collapsing, I am dying." You experience racing thoughts, and suddenly you're convinced, "I'm completely losing control of my mind." It's a vicious, terrifying feedback loop. The misinterpretation causes intense fear, which spikes your adrenaline, which of course makes the physical symptoms even worse, which then just confirms your brain's false belief that you're in real danger. Boom, an unexpected panic attack appears seemingly out of the blue.
All right, let's shift gears to Section 4, the toolkit, immediate coping strategies.
Now that we know exactly how the trap is set, how do we break out of it? Well, during a panic attack, you are highly likely to hyperventilate. So, the absolute first thing you must do, if it's safe, is stop whatever you're doing, close your eyes, and take control of your breath. We're going to use what's called the 3-2-3 breathing technique. Taking deeper breaths than usual is the key here. Let's actually just do one cycle together right now. Settle in. Step 1. Inhale deeply for 3 seconds. 1, 2, 3. Step 2. Hold that breath. 1, 2. Step 3. Exhale slowly. 1, 2, 3.
Regaining control of your breathing physically stops the panic attack from intensifying or lasting longer by quite literally forcing your nervous system to calm down.
Once you've got a grip on your breath, you need to challenge those racing, anxious thoughts we talked about a minute ago. You need positive, factual, and simple mantras. The first one is, "This is just my anxiety." When your brain is screaming at you that you're having a heart attack, you use this factual statement to interrupt the panic cycle. You are explicitly telling your brain, "Look, I recognize what is happening right now, and it's just anxiety. It's a false alarm."
The second mantra is equally powerful. These feelings will pass. Remember our earlier comparison between panic and anxiety? We learned that panic attacks are abrupt and usually wrap up quickly, in about 10 minutes. By repeating "these feelings will pass," you are reminding your terrified brain of a clinical fact. The window will close. You are not trapped in this feeling forever. Addressing and challenging your anxious thoughts with these simple facts is exactly how you alleviate the panic.
The third immediate strategy is distraction. When you're panicking, all of your mental energy is turned entirely inward on your terrifying physical sensations. You have to forcefully rip your attention away from that internal spiral and shift your focus back out to your surroundings. Just pick one single object right in your eye line. It could be a vase on a table, a plant in the corner, or even just a building out the window. Now intensely study it. What is its exact color? What does its texture look like? What's its shape? How big is it? Forcing your brain to process these external, mundane details distracts you from your negative thoughts, calms your mind, and grounds you right back in reality.
Finally, Section 5, the long game, management and care. So those are the emergency brakes, but how do we stop the car from speeding out of control in the first place? If you're suffering from unexpected panic attacks, self-care and professional support are absolutely vital to prevent them from hijacking your future. There are 3 highly effective long-term strategies you can employ. First, learning to relax. Techniques like progressive muscle relaxation or PMR, mindfulness apps, or yoga help minimize your day-to-day stress, which stops you from ever reaching that threshold where a panic attack triggers. Second, communicating. Talk to someone you trust. Relieving pent-up frustrations and voicing the specific thoughts causing you worry can massively reduce your internal pressure. And third, accessing cognitive behavioral therapy, or CBT. This is a tried and tested therapeutic intervention. Specialists use CBT to help you actively look into and address the dysfunctional underlying thoughts that are contributing to your panic. A professional can help you understand your hidden triggers and even prescribe medication if it's appropriate for your specific situation.
We've covered a ton of ground today, from understanding the clinical reality of unexpected panic attacks, to realizing they are really just a biological false alarm, to learning immediate breathing and grounding techniques. So I want to leave you with this final empowering thought. Now that you know it's a false alarm, how will you take control of your mind the next time it rings? You are no longer helpless. You have the knowledge, you have the mantras, and you've got the toolkit. Thank you so much for joining me for this explainer. Keep learning, keep breathing, and remember, you absolutely have the power to take your control back.